Hello? Okay, perfect. Hello, everyone. Thank you to Dr. Tash for the introduction. I'm very glad to be here. My name is Michael Guterbock, and I am a consultant and director at the Economist Impact. And as Dr. Tash spoke about, we helped commission a report called Undetected and Undertreated, Shaping Political and Policy on Atrial Fibrillation in Saudi Arabia. And this project was funded by Johnson & Johnson, but we had complete editorial control. So I'm just going to do a very quick overview of the findings from the report, and then we'll speak with three panelists actually, to discuss some of the findings and some of the opinions. So just a quick background on the objectives. The objectives were to drive critical conversation around the risk and burden associated with atrial fibrillation, to engage some key stakeholders in the discussion, and to identify quick wins and things that could be done now to help advance treatment and diagnostics of atrial fibrillation. So the project scope was, again, the burden of atrial fibrillation within first a global context, but then specifically within Saudi Arabia, and to contextual health and systems and populations dynamics, as well as to identify the current pathways and the barriers to AFib prevention and management. As you can see, I won't go through all of them, but there were a lot. We engaged with a lot of experts in the region. They gave a lot of good input in addition to some of the desk research that we did to make the report. So some of the key findings, first kind of a bit of a global view, was that the incidence of global atrial fibrillation has increased 30% over the past 20 years, and it's expected to double over the next 3 decades for multiple different reasons. And there's an estimate that 30% of AFib patients are asymptomatic, which of course makes it very difficult to detect. And 1 in 4 stroke patients have atrial fibrillation, and that the prevalence of atrial fibrillation is increasing rapidly in the Middle East and specifically also in Saudi Arabia. The economic burden, of course, is quite high, with 31 billion in the United States and projected to increase to over 65 billion by the year 2045. That's speaking about the US. And in the UK, the increase is over 4% of the annual expenditure in the last 2 decades. So specifically within Saudi Arabia, if left unchecked, atrial fibrillation would become a major public health problem. It's alarming. There's already alarming rates of chronic disease in the country, and the burden of chronic disease is also likely underestimated due to poor data collection. And there's an aging population, as you know, within the region in general, and also specifically within Saudi Arabia. So Saudi Arabia is also working to restructure the primary healthcare services, in part to address some of these chronic diseases, such as AFib. And Saudi Vision 2030 explicitly targets the management of heart disease, stroke, and diabetes, recognizing that these are increasing problems. So now just a quick snapshot of some of the key takeaways that we found during the research. So first is bridging what's necessary to bridge some of the data gaps. So there needs to be maintenance and also the expansion of AFib patient registries that prioritize AFib and CVDs, and also a scaling up of high-quality evidence-based research. Local research, which is the best type. Secondarily, expanding the primary and secondary prevention strategies. So prevent the onset of progression of AFib by way of lifestyle interventions, education campaigns, early detection, and also effective management of the disease. And expanding the role and the reach of primary healthcare centers, so PHCs. Thirdly, determining the parameters for AFib screening is incredibly important. So to determine the appropriate guidelines for a screening unique to populations, so population demographics, health system capacity, and also the financing structure of the health system. And there's also opportunistic screening guided by age and has not been seen to show an increase in AFib detection rates, so that's an important finding. And also it's important to integrate pulse checks into annual checkups to make it be an appropriate starting point for screening. Also, standardizing healthcare pathways is an incredibly important way to help combat the problem. So adopting an integrated model of AFib care across the system and also setting up clinics, AFib clinics, and centers of excellence that bring together multidisciplinary teams to help work on the problem. And finally, it was found that nurse-led AFib clinics can help alleviate some of the healthcare system pressure, so not necessarily just hospitals, but actually clinics. And finally, there's a preparation for the digital revolution. We all know it's coming, or it's here already. It's in the process. As the panelists were just speaking about, there's the rate of digital revolution is increasing. So it's important to adopt emerging digital technologies, some of which are already happening, and also to use these digital technologies because they're more accurate for detecting the asymptomatic and undiagnosed AFib patients. Vision 2030 and the health system has a goal of having 100% of the population in Saudi Arabia covered by the unified digital medical record system, which would be a great step in the right direction. And finally, some of the other key takeaways were related to empowering and educating patients so that they can take better lifestyle choices, but also better treatment choices. So engaging patients in treatment decisions that empower them with the tools that they know so they can probably help with their treatment adherence so that they are following what is recommended. And also enhancing patient-centric care, which is, I think, true of any disease really, but also true of AFib. Global and local patient scientific organizations need to really advocate for the patients, and they also play a critical role in driving this public awareness. So those are the findings from the report. You can download the report here using this QR code, and now I'll sit over there with my colleagues, and we can discuss some of the findings and some of their opinions. Thank you very much.